Other questions? Lady right down the back, Steph.
Hi, Annie Birmingham, Southern Cancer Network manager. So I just wanted to say something because I've come in obviously late, which is why we're down the back, and just heard the question saying that there's some areas that are doing their own thing and doing it in a really strong and good way. But I'd just like to sort of bring the conversation back, and it's not so much a question, but a thought, is that we're involved in our work and our sort of everyday work around healthcare. But I just want to go back to, for me, an experience last year supporting my father who had advanced dementia through the palliative care process. Now, even with the background in health and with people that were supporting us who were really good, it wasn't a given that all of the things that should have happened occurred automatically. And so my question is, I think it's great that there are places who are really getting on and doing that, but my view and my experience is that there is not equitable access in this country for people who are needing palliative care for the right things in place. And so long as that occurs, there's a requirement for something that goes wider than each area's sort of best practice, which is a baseline minimum of what we can expect. So I think just purely from my own experience, my lived experience last year, I can see that it is easy for people to fall through the cracks and for families and people to not necessarily get the benefit from some of the systems that are out there. So I guess my interest is thinking what systems are akin to this, and kind of getting away from the thought that one system precludes another to going, what are the minimum baseline requirements that everybody should be able to access, regardless of where they live or regardless of where they've got good advocates. And I guess I just want to bring it back to that, because I think in the country that we're in, we're kind of prone to going, we'll do this way here, this way there. You can still do that, but stay as a baseline. We think this is so important that it should be accessible. Doesn't matter whether you're in a residential care facility or whether you're just going through the process at home. So I just want to bring it back to personal experience and to the reality that not everybody currently going through palliative care today is accessing the kind of good benefits that might occur in small areas. Hence, I think there is a requirement for a broader, more consistent agreement of what we think should be available. Yeah, not a question.
No, thanks for your comments. That stands alone.
If I could just make a comment there from the hospice point of view, Hospice New Zealand is in the process of piloting hospice palliative care standards. And again, that's an initiative designed to ensure that hospices across the country are working to the same set of standards. So it's heading in that direction, if you like. Other questions? Steph?
I believe you're losing weight, Steph.
Thank you. Joy Percy, Palliative Care Specialist in Palmerston North. Just apologies if you already made this comment, Simon, but just looking at what's been happening with the Advanced Care Planning National Cooperative, has that comment been made already? I know that, was it Judith alluded to Lee Manson. Many of us for many years have been talking about advanced care planning and getting something off the ground. And a national initiative has started up in Auckland with funding from Auckland Hospital, I understand. But they've actually, they've got a national cooperative, which many of you may already have been part of. I know some of the people in the room have too. And I guess it's a good example of how getting good leadership and getting some funding, which has been provided, in this case, locally or in Auckland, is an example of how well this has all been pulled together with a particularly good leader. And I'm just wondering, what we're saying, we all have great passion and want to do a good job and do it well, and we've all talked about this for a long time, but we do need some good leadership, I think, and we do need to look at what's happening nationally. Now, just as a further comment about the Advanced Care Planning Cooperative, they are rolling it out in Auckland, but many people, as you probably know, can video link into the, I think they're 3 monthly meetings, and there's newsletters that come out frequently. Now, they are setting up a communication package, which I I know this is one of the keystones to advanced care planning, that we actually learn how to do good communication around this subject. So that is happening, and it is happening nationally. So I guess my question might be, that the gold standards framework, advanced care planning is part of that. Does the gold standards framework need to feed into this national cooperative and try to work with the national cooperative, because that's only one part of it, rather than once again everybody going to do something different and develop advanced care planning within? So something's already working and working well, I believe, so that may be an opportunity to perhaps have discussions with that group around the bigger picture, not just the advanced care planning part of it.
I mean, certainly in my thoughts, any move to gold standards framework and advanced care planning would incorporate all the New Zealand thinking on that, of which there are now guidelines and a toolkit, educational toolkit, which actually makes the whole thing look terribly formal, when I think advanced care planning could be very simple, because it's got no legality as such, but it could be actually dead simple.
Bob Fox, the Palliative Care Council. Can you tell us how far away those guidelines are from general publication? The
guidelines are on its sort of final check around, and should be published shortly. I mean, very shortly. Imminent.
Just about ready for morning tea. Any, Barry?
Barry Keane, yeah. Look, it was about pulling it together, really, because I noticed that there's quite a bit that has been said about local initiatives, which is really sensible, and I think speaks well for the New Zealand experience of palliative care. But at the end of the day, the gold standards framework seems to be around some really key principles, which is about increasing the quality of care, improving the coordination, and reducing hospitalisation, which is obviously a key priority. But it seems to me that there is an opportunity to look at the broad principles of gold standards framework and integrate them into what's already going on in New Zealand. And I think some of the building blocks are already here, like advanced care planning, like LCP, and I think there's a lot to be learnt from our experience of LCP in New Zealand. And it seems to me that there would be maybe an opportunity to look at some sort of at least exploring a pilot for gold standards framework in New Zealand, which could be evaluated and give some evidence of its value where it could spread nationally. I think one thing that's kind of absent here is that sense of who's going to champion it from a generalist perspective. You know, Kerry talks very strongly about it being embedded very much in the generalist sector. A lot of us around here do speak from a specialist point of view. So my suggestion really is that getting the generalist championship component of it needs to be more defined, but also to look at some kind of national pilot, which would bring from the ground up some of the good stuff that's been described today into a more of a whole systems approach, which is what Kerry has said from the outset. Thank you.
Do we have any GPs here? Would you like to make any comment on your sort of perception, your feeling, your views?
I'm Esther Willis, a GP at Albert Street. I'm also the GP representative on the hospice board, and I've just in the last week or two undertaken to be involved in the medical care of one of the local care facilities. So if there's one thing I'd say, just sitting listening, it's hugely important that you have generalists working on the ground doing the stuff that are involved in the planning. We've recently been involved in our practice in trying to implement something that has been planned by people with incredibly good intentions, but in the office, without the general practice experience, and it's got huge holes in it. The other thing is, GPs get very, and I'm talking specifically about GPs now, but we get very protective of our patch. And you can't help it when you've been involved in the care of people for 10 or 20 years and you feel like somebody else is coming along telling you how to do it. It's hugely important that we're able to work as a team. That's all right.
Thank you. I guess the part of the challenge we face, and I think it's come up in numerous forums, is that, you know, GPs are changing. The new breed of GPs are slightly different, and there are people who don't have a GP. So that's all changing, and I think in a lot of the literature coming out, it acknowledges that this big baby boomer bulge that's coming, coming through the system, many of our general practitioners are part of that bulge. Just when we're going to perhaps need those people, many of those will be exiting the system as well. Do we have any other questions? Okay, well, thank you, Simon. Appreciate it very much, and I think I have a little gift here for you on behalf of the organisers, and thank you very much for your input. Thank you.